Over the past half century, oral health in the U.S. has improved dramatically. One of the primary forces behind that has been community water fluoridation. Fluoride in general, fluoride products, but particularly community water fluoridation. For more than 65 years, Americans have enjoyed the benefits of community water fluoridation, and they have been significant. So much so that several years ago, the Centers for Disease Control and Prevention called community water fluoridation one of the 10 greatest public health achievements in the United States ever. And that benefit continues now, even though we now have other sources of fluoride. Most notably, we have fluoride toothpaste, which came into effect probably 20 years after fluoride in the water. And the reason fluoride toothpaste, fluoride mouth rinses, fluoride gels that you get at your dentist, fluoride varnishes, all these products came about because of the success of community water fluoridation. Well, when community water fluoridation first started, it was the only way we got fluoride. And now with all these other sources, the Centers for Disease Control and Prevention and as part of the Department of Health and Human Services made some minor adjustments to the amount that they recommend being put in the water. We fully support those adjustments. It really makes logical sense that now that we have all these other sources, and since community water fluoridation was optimized to prevent tooth decay at the time, and at the same time limiting any chance to get excess fluoride, now that we have these others, we needed this small adjustment down. So the federal government, the major organizations like the American Medical Association, American Dental Association, World Health Organization, all continue to support fluoridation as water fluoridation as a safe and effective way to prevent caries. Certainly we at Delta Dental also support the continued use of water fluoridation. Probably one of the best things that a community can do to provide or to protect the oral health of their citizens. Well, we know that the last time that the water fluoridation guidelines were changed or updated was 1962. And they've served us well all that time, but in 1962 the guidelines were based on the fact that children in warm climates drank more water than children in colder climates. And so it made sense that in warm climates you put less fluoride in the water and more in colder climates. And so we had this standard of 0.7 parts per million to 1.2 parts per million. And at that time, that was the only source of fluoride. So now we had toothpaste, we had rinses, other ways of getting fluoride. And also we know from national studies that children no longer, there's not that variation anymore. Children in cold climates drink about the same as children in warm climates. And that's primarily because of most homes are air conditioned now and consistently heated. So we don't have that variation any longer. So the combination of children drinking about the same amount of fluid no matter what climate they live in, multiple sources of fluoride, and also national studies showed us that across that full range from 0.7 to 1.2 you got about equal tooth decay prevention benefit. But the higher you went in the range, the more likely you were to get excess fluoride, particularly if as a young child you swallowed toothpaste or were getting supplements or things like that. So it makes best medical sense, it makes best public health sense to use the least amount of a preventive benefit, and that's why this recommendation was made to use one standard for the entire nation, which was 0.7 parts per million, which was still in the optimal range as set before, but now is providing the most benefit for the least amount of use.